Other news, health experts have tipped technology to go a long way in helping provide opportunities for persons living with disabilities in the country.
When someone suffers from limb loss, you replace their missing limb with an artificial limb. We make prosthetics for arms, for legs.
Take care yourself. Mambo ni mingi uko nje. Tukambi ni kwa mahali yetu. Nikakutana hii accident.
And since we use this 3D technology, we are able to lower the price for Kenyan patients while we actually keep a very high international standard.
Ilianza na kidneys, ndio mguu ikaanza kuparalyze, ndio ikabidi sasa wakate huko.
Kwa ni ajali ya barabara, nilienda kushuka, conductor akanisukuma nikaslide, gari ikanikanyanga mguu. Nilikuwa nimeruhusu hope kabisa.
Alidungwa shindano, sasa hiyo shindano ndio ilimuaffect mguu mmoja.
Road accident. Gari ilianguka, nilikuwa kwa basi ikaanguka. Bahati mbaya kanikata mguu.
Niko ndarwarire murimu wa cukari, ndio diabetes.
Accidents. Barabarani.
Ilikuwa accident ya moto. Fire.
Nilianguka kutoka kwa gorofa. Nikaumia mguu na mgongo hadi mguu ikafikia kukatwa.
Changamoto ni mingi kwa maana kutembea ni shida. Hata kubeba kitu ni shida.
Ng'ang'ana tu juu saa ingine pesa tunakosa, juu lazima ilipwe cash. But nafurahia hapa ni free, hakuna tu tunalipa.
Nilikuwa na shida sana kwa sababu siwezi tembea kwenda kwa shamba. Siwezi fanya kazi ambayo nilikuwa nafanya. Naona ilikuwa shida tupu.
Juu mimi wana marafiki wangu wanapenda kufuatilia venye wako ambao wako na miguu kama mimi. Sasa nilikuwa tu tunaongea, kaniambia kuna mahali wanapeana mguu.
No mundu okiria kingora akinjira hari undu ingihota guteithika. I was visiting Kinshasa, Congo for a project when I saw a lot of amputees. They were sadly enough sitting on the streets. It was rain season, so they were literally sitting on the ground in the mud. And my first thought was, it was 3 years ago, my first thought was, how is this possible? In the 1800s, pirates had wooden legs. Why can we in 2020 not give people a leg? This doesn't make any sense.
My name is Dr. Nick Were Omolo. I am a medical doctor and an orthopedic resident at the University of Nairobi. I'm very passionate about surgery and the impact that it has, especially in low and middle income countries like Kenya. I have had a very broad experience of about 10 years working both in the public and private sector. And in the public sector, I noted a significant gap of wounds that are not well taken care of by doctors in the periphery. And by the time they come to a hospital and to a surgeon, then they are basically cannot be saved. And we ended up amputating very many of these patients. In between that, I also got inspired, got together with my co-founder and started off Prothea Kenya. Now, Prothea Kenya is a company geared towards solving this issue of amputations. We see that amputations are getting more and more, considering that people are living longer and healthcare is getting better and better. So for those who are amputated, they're gonna live longer. And Prothea has found a solution for these people, providing prosthetic devices for them at an affordable price.
My other company, Ugani Prosthetics, that is a Belgian company, and that is the company that has developed the 3D workflow to make these prosthetics. So we are implementing this workflow here in Kenya through Prothea Kenya.
Traditionally, we'd make these devices from a long process where the client would come and take a wrap of the stump and make a positive mold out of it. And basically, even if you talk to prosthetists, it's a very tedious affair that takes a lot of their time. Now, with 3D printing, we have made it possible for the prosthetist to interact with the patient still, assess the patient still, but digitally, not manually, but digitally. And we just using an iPhone, we use the facial recognition technology with the LiDAR scanner and get a picture of the stump. Once we have that, we have our software that we use to make a digital model of the socket. And once we have that socket, we move the file to the 3D printer and it prints the socket in about 8 hours. Now,
my name is Geoffrey Maragia. I am a 3D engineer at Prothea Kenya. Basically, 3D engineering involves taking a 3D modeled CAD, which means computer aided design. So it's a design made in a computer, and basically transforming it into the real world. Depends on the size, but normally between 7 hours to 12 hours, depending on the size. And which is and that benefit is no one has to really man it, so it is automatic. I just spend 10 minutes per print, and once everything is set, I don't need to watch it, I don't need to do anything. It is fully automatic, which means I have one of the best jobs.
Hi, my name is Amos Wafula, working in Prothea Kenya. Currently I'm in Rongai. I've come to see a young boy by the name Victor Nyasinga. This is a boy who got an amputation a year ago through road accident. So I've come here to fit his prosthesis. So for the Prothea Kenya, what we basically do, sometimes you find people with the amputees who are unable to come to our office in Nairobi to do the measurement and the fabrication process. So such a people, we always go to their homes, scan from their homes, then deliver process to their homes. Then they can just work from their homes. That's what we basically do.
We are really keen on reducing the number of amputees that lack access to prosthetic devices. And one of the ways is through our Project 300, to be exact, Project 325, where we were able to secure funds. With these funds, we identified needy cases of patients who have not had a prosthetic device before. Then we opted to provide free prosthesis to 325 patients who have below-knee amputations. So far it's going well. We are currently at the tail end and working to reduce this percentage of people who don't have access.
Patients have been very happy. We've also had a lot of response from patients who have had a prosthetic fitted in another workshop who are quite surprised.
And this is the major point. This is one of the missions actually of our company, to increase the awareness of prosthetic devices, to give hope to amputees who have lost hope from the loss of their limb, to make it more affordable, to increase the provision of these devices, because as the number of amputees increases and the lack of provision of prosthetic devices by many insurance companies, it is important to make them more affordable. Can you believe that about 80% of amputees in Kenya lack access to prosthesis. This is a huge number, and the mission is to reduce this percentage to an acceptable number.
Mi kwanza niseme shukran sana na barikiwe sana na ametuwezesha kumove to another level.
Nimeshukuru kwa maana sina pesa ya kununua.
Ningemwambia tu asante na Mungu ambariki.
Ningependa kumshukuru sana sana kwa ajili mimi sijui kama ningekuwa nimegonjeka, singekuwa na hope ya hiyo mguu. Juu nilikuwa mimi hata nauliza kwa nini mimi nilibaki mahali pale sikukufa.